Hi, my name is April,
And I'm Tessa.
and we are your ketamine team leaders. And we were going to talk about some ketamine options today and some frequently asked questions.
All right, April, what is ketamine?
So, we use ketamine as a form of medication in office to help with depression diagnosis, PTSD, anxiety, but it's just a different form that it uses on different receptors in the brain to help alleviate that with, as an alternative for other medications.
Yeah, so it's different from the SSRIs, SNRIs, the typical
Yes.
psychiatric medications that you think of.
Where you have to take it every day by mouth. This is definitely a different option for them. So here at Gupta Psychiatry, I know we have different options for ketamine. What are they?
Yeah, at Gupta Psychiatry, we offer 4 different types of ketamine right now. We offer the IV or intravenous ketamine, the IM, the intramuscular ketamine. We also offer dissolvable tablets and a nasal spray, which is a form of s-ketamine, which is FDA approved, also called Sprovado. And April, I know we said we have 4 different types of ketamine. What are some of the differences between them?
So as far as the differences of ketamine, we have the intravenous, what you were saying, which is going to be your most, what they say is bioavailability. So 100% since it goes straight into the vein, you're getting most of that medication. And then we also have the next one is the intramuscular, the IM. So that's going to be a little bit less, like 95, 99% bioavailability, just because it has to get, soaked up by the muscle. And then we have the intranasal, the Sprovado, which is 70, 80%-ish. And then the less is the sublingual tabs. And so that's about 30 to 50% bioavailability. So we have different mechanisms of actions. And so, with it being absorbed in the body differently, it's just, different routes that we give. So we have plenty of options for everyone. How would you describe for a patient between intramuscular and IV? Like, how would you describe that for a patient? Or
Yeah, if you're trying to decide between going the IV route or the IM route, typically I'll discuss with the patient how quickly they want to see the results. Both of those are usually pretty quick, though. A lot of people feel better after a little bit better after one treatment. So they're both pretty quick. The other option is if some people have like more of a fear of needles versus not. And I think as Dr. Gupta described to me one time, the IV is kind of like you're stepping down the steps into a pool, and the IM is more like cannonballing in. So the IV, you kind of like you feel it. It's a more gradual feeling, and the IM is kind of more of a rush.
Yes.
But again, the effects are very similar. The other big difference is usually the price point is a little bit different. The IV is not covered by insurance at all, and we have to pay for a CRNA to come in and administrate the medication, so it's a little bit more expensive, but you are getting a lot of bang for your buck with that 100% bioavailability.
Right.
What are some of the side effects to the ketamine treatment?
Oh, that's a great question. So this is a big question for a lot. The biggest side effect for all of the medications are disassociation. So disassociation is that out-of-body feeling. A lot of people will compare it to being high or drunk or, just using other illicit substances. But it's a very well-controlled environment. We definitely make it very pleasant. We have, weighted blankets. We recommend bringing your own headphones, eye mask. We, help the patient pick their favorite, playlist, definitely instrumental music in a calm, relaxed environment. So it's definitely can be anxiety provoking for some, but we definitely kind of set that setting up for it to be comfortable. Another one is, nausea, vomiting could be, those are probably the next, highest two, but we do pre-treat with Zofran or, other anti-nausea medications. So we can definitely talk you through that. And we have we've been through it all, so we're kind of well equipped for all of those.
We kind of have a way to make any side effects that you experience as pleasant as possible.
Yes. And then, of course, the high blood pressure. So that's why, the patients need to be here for 2 hours. So, we can monitor the blood pressure. Of course, we have, medications as needed if those, go too high. But again, it's very controlled environment. It's definitely safe. And we all have had much experience with everything. But I would say those are our biggest, side effects for all.
Yeah, biggest side effects. The biggest complaint we have is usually the taste with the nasal spray.
The taste.
Just that post-nasal drip that occurs. Not the best taste.
But yeah, we've learned over the years of how to fight the taste, and to just the appropriate administration can help with the taste as well. So yeah, we're pretty well equipped for everything. As far as the ketamine treatments, how long do we tell patients that we need to have them monitored here?
Yeah, for the length of each appointment, typically the go-to is about 2 hours for each treatment. The IV, you might be able to get out at about an hour, depending on your session and how it goes when you're cleared. Just because it is a little bit faster of a process. And once your IV is cleared, you're unhooked, you're pretty much good to go, as long as you have transportation home. With the IM and the nasal spray and the tablets, those are all closer to the 2-hour mark. Just because we do need to make sure that like your vital signs are back to normal, you're not nauseous or anything anymore. You feel more connected to your body, that disassociation feeling is gone, so you're able to walk out of the building unassisted. Again, with any of the options, you cannot drive following it, so you do need transportation home. But it's safe to estimate you'll be in the office for about 2 hours following the treatment. So April, how many treatments, or what's the frequency for doing these treatments?
Good question. So, the ketamine versus the Sprovado, this is a big question, for all, just to kind of, when we're trying to steer a patient to which treatment to pick. The price is a big one, but also the frequency of treatments is another one. So the ketamine treatments, which is the IV, the intramuscular, and then the sublingual tablets, so we recommend the 6 treatments. And so that could be twice a week for 3 weeks, once a week for 6 weeks. We also can, tailor it to one's needs, depending on their financials and the commitments and time allotted. So, we could do twice a week for 2 weeks, once a week thereafter. But we always like to commit to those 6 treatments, because that's what's been studied, and how many treatments are required to kind of get that full effect. And then after those 6 treatments, then what we would do is kind of do an assessment after, and then follow up maybe monthly to see, when those boosters need to happen. And so those boosters would just be, you would come in for that one booster and kind of see. So people can go every month, 2 months, 3 months, even a year we've seen. And so that's more flexible in the way. And then also our Sprovado, the nasal spray, it's FDA mandated. It's a little bit more stringent. And that treatment plan is twice a week for 4 weeks, and then once a week for 4 weeks. And then we kind of do a reassessment after that 8 weeks. And then the medication is meant to be continued on. So either once a week thereafter, or up to every other week. Again, we can tailor it to one's needs, maybe once a month, maybe, twice or once a month, but it's meant to be an ongoing treatment. So that's basically the difference when we're trying to steer a patient into which treatment to use. It's, that's more financial equipment requirement for the ketamine, but the length of the time is much shorter for sure.
There's more flexibility there.
Yeah,
than with the FDA mandated Sprovado.
Yes. All right, Tessa, another big question is, how do we figure out the dosing for ketamine, and even Sprovado, I guess, too?
Yeah, of course. So Spravato is the easiest dosing. It comes in 3 doses, already like prepackaged in the kit that you get or that we get from the pharmacy for you. It's in 28, 56, or 84 milligrams. And that is what the dosing is. It's already predetermined, pretty straightforward. We'll usually start off with 56 milligrams and work your way up to 84. And most people end up on the 84 milligrams. A few people stay at 56 because that's what works for them. For the ketamine, both the IV, the IM, and the sublingual tablets, those are all dosing based on your weight initially. Mm-hmm. So grab your weight every time before the appointment to kind of make sure that we're in the right ballpark, whether you've gained weight or lost weight. We kind of go from there. So we'll start off by doing, it's 0.5 milligrams per kilogram is what we start off doing. And then based on your response and how it goes, we can work our way up to 1 milligram per kilogram. And we'll generally stay in that range throughout all 6 treatments.
Mm-hmm. And I knew one thing too is that there's, a bell curve, right? Mm-hmm. Especially for treatment-resistant depression, PTSD, and anxiety. It's like there is, you can give too little, but you can also give, too much. So I know a big question too is, why can't I just get more and more and more as I'm tolerating? But then honestly, if we give too much, we're almost, battling it back. We have to kind of stay in between that sweet spot.
Right.
And then, of course, all doses are checked with a doctor and doctor approved.
Mm-hmm. So, April, a lot of the patients that come to see us when they're considering ketamine are taking other medications. Is that something that continue, or are there any contraindications with what they are taking?
Right, that's a great question. So as far as contraindications go, definitely day of treatment, we want to stay away from any stimulants. So a lot of ADHD medications we want to stay away from. Anything that can raise your blood pressure, because that's our biggest concern. And then also benzodiazepines. We want to stay away from that just based on the more sedation you can feel. And then also it can kind of limit your experience during the treatment. So definitely benzodiazepines and any stimulants we want to stay clear of because we are worried about blood pressure increasing. We definitely want you to take your antihypertensive that morning. So all other medications, if you're on thyroid medications, blood pressure medications, asthma medications, anything, we definitely want you to take, continue those. And then of course, any of your other mental health medications you take, as prescribed. And then they're leaving the appointment, you can go ahead and resume any of those medications. Stimulants, probably not, because you may be later in the day, but benzodiazepines, those can resume right after you leave for treatment. So another question is, a lot of people will come wanting ketamine and their goal is to get off of medications. How do you kind of explain that to patients starting ketamine?
Yeah, basically I'll tell people who want to get off their medications that it's an option that we can consider down the road, but we definitely want to get them well established with their ketamine treatment to figure out if that will be a good possibility for them or not. It might be something more like with the Sprovado. It has only been studied in conjunction with some sort of base antidepressant. We've had a couple patients I know who have tried to stop taking their antidepressants and end up going back on them because it does work better in conjunction with an antidepressant. But I've had a lot of patients who are able to cut back on the number of medications that they're taking when they've done the ketamine.
Yeah.
A lot of the anxiety medications can kind of go away. Some of the extra things that have been built up.
Right. And then kind of just slowly tapering off other meds, which is great.
Don't expect to be off all medications, but it's not out of the question either.
Yes, I agree.
April, what are some medical contraindications that could not allow a patient to do ketamine treatment?
Yes. So we definitely do an assessment prior to any start of a patient doing ketamine treatment, Sprovado, IV, IM, you would do definitely an assessment with one of our providers here. And we go over, any of the medical contraindications. The biggest one is uncontrollable hypertension. So it's not meaning that if you have hypertension that you can't do treatment. We just want to make sure that it's controlled. And so, of course, we would take your blood pressure during your assessment to go over your medications and, things like that. So we definitely wanted to be safe during this process. And so making sure your blood pressure is well controlled. As far as other contraindications, patients that may have experienced psychosis or in some type of psychiatric or psychotic break, we wouldn't want to, give the Spravato or ketamine during that.
I mean, we're careful when it comes to like the recent heart attack or brain aneurysm, stroke.
Yes, correct.
We will definitely need clearance from your cardiologist before we go near any of that.
Correct. You're right. Yep. Definitely if there's any recent strokes or, we would get clearance from cardiologists. Good point.
But it's a pretty safe medication.
Exactly.
Overall, not a lot of contraindications there.
Right. Another question, Tessa, would you be concerned if a patient has had history of substance abuse during this treatment or, current, or how would you kind of?
That's an excellent question. It's definitely something that would need to be cleared by one of our providers. It's not, right now, ketamine isn't indicated for any treatment of substance use disorders and is generally not used with that population. However, they're doing a lot of studies that it's actually very helpful. So patients who are in treatment for their substance use disorder and have made it past a certain point where their provider feels like it is beneficial for them,
right,
then we'll definitely consider it. If they're in an active substance abuse episode where we have no real knowledge about what's being taken outside of our office, then we'll typically hold off on the ketamine treatment until it's been more controlled at that point.
Right. Yep. And we definitely are, controlled as far as the urine drug screens, making sure that's clear. And of course, yes, making sure that they're actively in some type of treatment if they are dealing with those types of issues. And two, I think it's known that, it's very well controlled. So, we can't go a certain amount of treatments per week or, total sessions. It has to be continued to be approved by the provider. So, if you do have concerns, because if you've been in treatment or in treatment doesn't necessarily mean you can't have ketamine. It's just some speculations where we have to.
Yeah. And it is very controlled. Like you said, the dose is all weight-based and cleared by the provider beforehand. A patient never goes home with the medication. It's all administered at the office. We keep it in a safe, contained, locked up place. So there's no real chance for abuse from that standpoint.
I agree.
April, tell me about the setting that we do the treatments in. What does the room look like? Are patients sharing rooms?
Right. So this is big. This is a great question. So setting is almost everything. I mean, it's the medication and then we have the setting. It's proven time and time over again. So we do have private rooms. So we do have a recliner for each patient to receive their treatment. And then we also have another chair if you would like a support person or, if your driver wants to hang out. But it's definitely more of an individual experience. So you do want to talk with your plus one to be quiet, and either they can listen to their own music but not to talk, and just kind of have you have your own experience through the ketamine. So we have the recliner, we have weighted blankets, which is popular.
Very popular.
We recommend the eye mask too. You would have to bring your own. We don't supply the eye mask. And then of course bring some headphones. And then it's the instrumental music, music with no lyrics. We kind of just get you all set up. We like the lights dimmed or no lights. And we just like a nice little ambiance, but yep, private rooms. You'll have it for the duration of the whole 2-hour appointment. We also offer snacks and beverages, and we just want to keep you comfortable. And again, it's just kind of setting that tone for a nice, pleasant, just chill environment.
That calm, personal space.
Yes. Could you add anything else?
I think you covered most of it. Like weighted, we have normal blankets if weighted blankets aren't your thing. Fans if you get too hot.
Yes.
We do have some essential oils to kind of help with setting the tone as well. Yeah, I think you about covered it.
Okay, Tessa, so as we are growing, how many locations do we have?
Yes, we are growing and it's very exciting. Currently, we have 5 open locations. We have one in North Raleigh. Our newest one is East Raleigh off Newbern Avenue. Then we also have Clayton, Apex, and Durham. And currently, I think the IV ketamine is only offered at our East Raleigh location. We're hoping to expand that in the future, but all other options, the sublingual tablets, the intramuscular, and the Sprovado are at all 5 locations. So chances are we can find a place that fits you, fits your schedule, and make it as easy as possible for you. Yay. So April, I'm a patient. I'm interested in ketamine Sprovado treatment. How quickly can I get started?
Yes. So we do same day appointments or even next day, depending on, time of day that you call in. New patients, we can get in rather quickly. We could do the assessment. And then as far as the ketamine goes, we have all ketamine in stock at our offices. So we can do treatment same day, next day, just depending on your timing. Sprovado can take a little bit longer, of course, because, we have to go through the insurance process and getting that approved. So I say typically within the week for Sprovado, and then again, same day for any of the other versions of ketamine.
April, what would you say to a patient who has like a solid 9-to-5 job, 5 days a week? How would they go about getting treatment?
I know. Well, that's what's so great about Gupta Psychiatry is that, we're definitely available for most hours of the day. We understand that any treatments, the Sprovado, ketamine, IV, any of these versions are a commitment to our patients and the transportation. It's not even on, all in the patient. You have your driver that needs to take you to and from, and they may have a job, you may have a job. So we definitely have early hours as early as 8 a.m. And then, we're here late in the evening until 8 p.m. Even and that's North Raleigh. And then, with our Apex and Clayton, we have evening hours then, Saturday hours. So we're definitely flexible. And yeah, like I said, we know it's a commitment. So we do want to make it available for you and your plus one. Well, thanks for spending time with us today. And if you are interested in some ketamine or Sprovado treatment and you're a new patient, give us a call. Or you can go on our website. And if you are an existing patient, you can give us a call and schedule an appointment with your provider. All of the providers are equipped to answer any questions. And of course, they'll lead you to us, the ketamine Sprovado team leaders.
We hope we answered any questions that you might have, but if not, feel free to reach out.
Hope to see you soon.